Hi, I am Jane McCampbell, and in this video I am going to talk you through the algorithm that we call Complex Trauma Complete. It's probably the algorithm that I use most frequently in my practice because it covers a whole range of emotions, from anger to grief to sadness to loss to guilt to shame, and then everybody's default emotion, which is of course anxiety. So to properly use this algorithm, what we first need to do is come up with a project, and that project that we're going to work on could be a traumatic memory from childhood or from a long time ago. It could be something very annoying or very distressing that's just happened in the last few hours or few days, and we somehow need to be able to put it aside so that we can get on with what we need to do. Or it could be an image that has somehow lodged itself into the brain that we can't get rid of, and it's one of those that's there every time we close our eyes, and it would be really lovely if we could just get that to go away. So whichever one of those it is for you, just bring it up, and the first task is to put a score on it, and this is a distress score, and the score rating goes from 0 to 10, with 0 being very ho-hum, no big deal, and 10 being very, very distressing, in fact the worst distress we could possibly imagine. So with your project and with your score, we're then going to come to the very first point, which helps us get the body ready for tapping. This is on your left hand, it's on the heel of the left hand, and it's called the karate chop point. So we're just going to hit that about 8 to 10 times here. Okay. And then bringing your image or your memory or your event to mind just for a moment, you're going to come up to your eyebrow here, and it doesn't matter which eyebrow, just as long as you are on the nose end of your eyebrow. This is your grief, sadness, and loss point. And then you're going to come under the eye to the cheekbone, and this is the first of 3 anxiety points. Your next anxiety point is under the arm. So what you want to do, ladies, you want to make sure that your middle finger is about level with the top of your bra strap. Gentlemen, if you just want to fold your arm across your pecs and then go with wherever your hand lands, you should be in the right place. Okay, and then the third anxiety point is called the collarbone point. And this takes a little bit of finding, so let me show you how to do that, because once you can find it, it's well worth using. Okay, so start at the V in the collarbone here. Okay, and then you're going to come down about 1.5 inches, and then you're going to move over about 1.5 inches and feel around, and there's a little indentation there between the collarbone above and the top rib below. Okay, and if you can find that little hole, you can almost stick your finger in it, and then we're going to tap there and just tap it with 2 or 3 fingers. Okay, if you do not remember any other point from this video, this is the point you want to take away with you. You can use it at any time. Nobody else knows what you're doing. It's very, very grounding. If your heart is going bananas, you can just slow your tapping way down and bring your heart rate way down too. And it will really help just ground you and get you back in your body. Okay. We're going to come back to it a few times in the course of this algorithm. But for now, our next point is on the left hand again, and it's the little finger, and we're going to tap it on the end here. This is our anger point. And we're going to come back to that collarbone point. And then we're going to come up outside of the eye to the temple. This is our rage point, and rage, of course, is powerless anger. Okay. We're then going to come back to the collarbone point again. And then back to the left hand, and this time we're on the index finger. And this is our guilt point. Come back to the collarbone point. And then come up to the chin. Okay, and we want to be between the chin bone and then the lip, so a little indentation there. Okay, this is your shame point, so just take a deep breath while you're doing this one. Okay, and then we come to what I call the chorus that is common to all of the algorithms in thought field therapy, and so you need to take your left hand again and make it into a fist, and then between the knuckles of the little and ring finger is our gamut spot, and so we're going to tap the gamut spot, and while we do that, we're going to close our eyes and open them again, look down to the left, look down to the right, do a circle around the room, go back the other way, count out loud to 5, 1, 2, 3, 4, 5, hum a few bars of a tune, and then 1 to 5 again, 1, 2, 3, 4, 5. Now just bring back up that image or that memory or that distressing event that we're working on in this session. Just notice it for just a moment. And then come back up to your eyebrow again. and then come under the eye, and come under the arm, and then come to your collarbone, to your little finger, back to your collarbone, come up outside of the eye, back to the collarbone, to the index finger, back to the collarbone, and to the chin. Take a deep breath. Okay, now bring up that memory or that image or that event or whatever it was that you were working on and check in on that 0 to 10 score. See whether the score has come up, down, or whether it stayed about the same. Now, if your score has come down to a 2 or below, you're almost done. There is just one more move for you. And here's what you need to do. You need to just look down towards the floor and very, very slowly just roll your eyes up towards the ceiling, just to lock in that emotional change that you managed to achieve. And you were done. You can turn the video off. For those of you whose score did not go to a 2 or below, there is another point I need to show you, and this is called the sore spot point. And again, we start finding it by going to the V in the collarbone. We come down our 1.5 inches again, and we come all the way over to the left. And round about here, we find the sore spot, so called because as we rub it, it does feel a little bit sore. Okay, and this is a wonderful spot for a number of reasons. It's a great one for if you ever get out of bed the wrong side. You can just rub this spot, and the way that it works is that you need to think about your life globally. Okay, so think about everybody who is in your life currently. Think about where you are living currently, thinking about what you're doing currently. Think about all of those things that are going on currently in your life. Okay, and then gradually bring your thoughts in back to the image or the memory or the distressing event that we have chosen to work on in this session. Okay, just focus on it for a minute, and then you're going to come back up to your eyebrow, and we're going to run through the sequence again. Come under the eye to the chin, under the arm, back to the collarbone point, the original collarbone point, to the little finger, back to the collarbone, up outside of the eye, back to the collarbone, to the index finger, back to the collarbone, and to the chin. Deep breath. Back of the left hand between the ring and little fingers, and close your eyes. Open them again, down to the left, down to the right. Do a circle around the room, go back the other way. Count out loud to 5. 1, 2, 3, 4, 5. Hum a few bars of a tune. 1 to 5 again. 1, 2, 3, 4, 5. Take a moment. Bring back up that image, that memory, that distressing event. Notice it for a second and come back up to your eyebrow. Under your eye, under the arm, to the collarbone, little finger, back to the collarbone, up outside of the eye, back to the collarbone, to the index finger, back to the collarbone, and to the chin. Deep breath. Check in with your image, your memory, your event. See what the score is. If it's come down to a 2 or below, you can look down at the floor and do a very gentle eye roll all the way up to the ceiling. If it's still above a 2, you can head back to the beginning of the video and run this again, or you can call me for some EMDR, and I'd love to help.